Singapore will ease restrictions for fully vaccinated people from Tuesday. The multi-ministry task force says the move is part of preparing for a new COVID-19 normal. Groups of up to 5 people will be allowed to dine in at F&B establishments if all the diners are fully vaccinated. Unvaccinated children aged 12 and below from the same household can be included within the group of 5. 2 people will be allowed to eat together at open-air hawker centres and coffee shops. That's regardless of vaccination status. The task force says this is a special concession since these establishments provide convenient and affordable food to the community. Social gatherings will also be increased from 2 to 5 persons if everyone is vaccinated. The same applies for household visits. However, unvaccinated people will have to remain in groups of no more than 2. Large-scale events may have up to 500 attendees if all are fully vaccinated. This applies to worship services, cinemas and MICE events, as well as live performances and sporting events. Otherwise, only 50 attendees will be allowed without pre-event testing.
For those who are unvaccinated, we will have to try to protect them through differentiated safe management rules. And even vaccinated individuals can still carry the virus and transmit to others. Therefore, it is best that unvaccinated individuals minimize their potential exposure to the virus at big events and at higher risk settings such as restaurants, gyms, and fitness studios.
From the 1st of October, unvaccinated people in certain sectors will also need to go through ART self-testing twice a week. The public service and uniformed services will start screening first. Those working in sectors that involve the vulnerable, like the elderly and children, will also be tested. Others to be tested include people working in higher-risk mask-off settings, like at borders, F&B establishments and gyms. Cheryl Goh has more.
The multi-ministry task force unveiled a 4-stage roadmap to bring Singapore back to a new normal. The first stage of what's called the preparatory stage begins on Tuesday with the easing of some COVID-19 measures. It will last about a month. Singapore expects to have 80% of its population vaccinated by that time, up from nearly 70% now. It will have to keep the number of severe cases under control and ensure healthcare capacity isn't overly stretched to move on to the next phase. Singaporeans can expect further opening up of the economy as well as social activities and travel if the country proceeds to what's called Transition Stage A in early September. But the multi-ministry task force says infection numbers as well as numbers of serious cases and even deaths are likely to rise. The country will try to minimize this by vaccinating as many people as possible and continuing with surveillance and routine testing. It will also expand wastewater testing to detect COVID-19 clusters early. If the pandemic situation remains stable, the country may consider opening up further to Transition Stage B and eventually a new normal. The multi-ministry task force did not give specific details, but highlighted the country's broad approach to reopening. Here's what Health Minister Ang Ee Kang had to say.
The transition roadmap will therefore be a very careful balance between lives and livelihoods. Ours will be a step-by-step approach, feeling our way forward, making judgment calls along the way, instead of one big bang where all restrictions are lifted all at once. And in this process, we will continue to push for vaccinations, implement differentiated rules on social activities to protect the unvaccinated, deploy testing as part of the solution.
Updating healthcare protocols as the COVID-19 situation evolves. Singapore will expand its community care facilities so that more infected patients with mild or no symptoms can be admitted there instead of hospitals. Fully vaccinated COVID-19 patients can also be discharged after isolating for 10 days, down from the previous 14 days. That's if they test negative or have very low viral loads. The changes were revealed by the multi-ministry task force today.
Reviewing our processes and management of COVID-19 cases aims to ensure that we have the adequate facilities and healthcare resources to treat those who are more seriously ill, need more intensive help and support, but at the same time ensuring that we can look after more COVID-19 cases in a sustainable manner as we eventually transit to a new endemic phase.
Professor Mark also explained why hospital visits are barred until the 18th of August, after 16 patients and staff at hospitals and community hospitals were infected.
As each case in the ward leads to the ward being locked down for at least a period of 2 weeks from the time of infection, this does have a significant impact on our bed capacity and the resources that we have dedicated to fighting COVID-19 cases. And this is the reason why we have recently issued a guidance for all hospitals then to discontinue allowing visitors to come in so as to mitigate and manage this risk.
Giving an update on how the pandemic has affected children below 12, Professor Mark says there are currently 89 infected children who are being cared for in hospitals. Another 35 are in the community care facilities. He also revealed findings by 2 local hospitals, which studied about 260 cases aged between 18 since last March. None required oxygen, supplementation or ICU care. They also did not have persistent COVID-19 related symptoms after they recovered.